We will, of course, continue this discussion as we speak now to Anele Yawa, who's the General Secretary of the Treatment Action Campaign. A very good evening to you. Thank you so much for speaking to us this evening. As the Treatment Action Campaign, I understand that you've taken an unprecedented decision to boycott the 25th International AIDS Conference. Why is that?
Greetings to you and greetings to the viewers at home. The TAC National Council took a resolution to boycott the 25th International AIDS Conference, which is currently taking place in Germany because of a number of reasons. One, Germany is supporting the government of Israel, and the government of Israel is continuing to bomb people of Palestine, and many people are dying, women and children, and the state of healthcare services in Palestine is in shambles. As the result of that, the majority of the public healthcare users, including people living with HIV, are unable to access life-saving medication. And as TAC, we wrote to the board of the International AIDS Society, including with other activist organizations, to call for the board of the IAS not to hold this conference in a country that is supporting the apartheid Zionist government of Israel based on issues of human rights. And if we are saying nobody must be left behind in our global response to HIV, what do we say about the people of Palestine who are living with HIV and who do not have access to treatment? But also, the laws in Germany do not allow activists to do what they do best, which is advocacy and campaigns, because you will remember since time immemorial, these international AIDS conferences, we use them as a platform as activists, one, to raise our concerns and also try to reason with the governments of our countries and other global institutions about the gaps which needs to be closed in order for us to be able to respond adequately to the global response to HIV. We use to picket in these conferences. We use to march where we're calling upon pharmaceutical companies to reduce the prices of life-saving medicines in order for them not to put the prices of medicines before the lives of the people. And in Germany, that is not allowed. Even the comrades from across the world, even those from South Africa who are attending this conference, will tell you that all what they do, the picket which they embark on is a staged picket where they are being told only to picket for 1 minute or else they will be arrested. And we felt that as activists and as people who defend the rights of the majority of the poor people, we cannot subject ourselves to that mediocrity. But also, these international AIDS conferences have since declined in terms of the impact which they make in terms of saving the lives of the people. You will remember in 2000 in Durban, TAC and other progressive activist movement, when this international AIDS conference was held in South Africa, TAC held a very huge march where we called upon the AIDS denialists, which were led by the former president Thabo Mbeki, the late minister, to provide antiretroviral treatment to people living with HIV. 2016, we did the same thing where we were calling for all people living with HIV across the world to be initiated on treatment. So, and now we feel like the money is being spent by many organizations to ferry people and to Germany to accommodate them. And we feel that such money could have been used better in ensuring that we put more resources in the struggle of making sure that we're saving lives. So there are a lot of reasons, but I felt like, let me highlight just a few, but we are not participating in that conference. Thank you.
As you speak about the importance of saving lives and that being a very valuable cause that you wish to see being implemented more aggressively. Here at home, as we look at the numbers, we know that those within the cohort of 15 to 24 years are the least to be on HIV treatment. Only 63% are on treatment compared to the higher age groups, those within the 40s cohort, going up to around 80%. What are your concerns in that space, and how do you wish to advocate for a greater response when it comes to young people knowing their HIV status and, you know, being part of the group to curb the infection rate within that age group as we face this debacle here in South Africa?
So in our view as TAC, there are two contributing factors in this. One, you will remember that as much as in the past 20 to 25 years, as TAC and other progressive forces, we won the battle of ensuring that pregnant women who are living with HIV give birth to children or babies who are HIV negative through the prevention of mother-to-child transmission therapy. But in that process, there were those children who were born living with HIV, and some of them were initiated on treatment. Some of these children, their parents died, and other people had to take care of them. And in that process, those who were taking care of some of these children when they were still young, they never told them the truth that they are living with HIV. As much as they were adhering on treatment, some of them only knew about their HIV status only when they were old. That is the first problem, which might have contributed to this age group getting infected with HIV, because in that process of them not knowing that they are living with HIV, chances of them indulging on sexual intercourse is very high. And in that process, simply because they never knew about their status, chances of them losing protection were very slim. But as TAC, we feel like what is important, or what has dropped in the country, is the education and awareness around HIV prevention, as well as the prevention treatment literacy education, where people will be educated as to say why it is important for people to prevent new HIV infections, to prevent sexually transmitted infections and all what have you. Because we are, majority of the people of South Africa, you can see, like for instance, this week is towards the month end. You can go to many pharmacies around Joburg. Mm-hmm. You will see young people queuing there Saturday, going for a morning after pill. What does that mean? It means they want to prevent themselves from not falling pregnant. It therefore means if you are going for a morning after pill, it therefore confirms that this person indulged on unprotected sex. It therefore means there is a lack of education around prevention. And that's why it is important that we roll out the treatment literacy education so that the young people, society begin to understand that our fight against the spread of HIV is not yet over. But on top of that, how do we make sure that we encourage people to go to our health establishments in order for them to be able to know about their HIV status, so that if you begin to test HIV negative, we know that you will be initiated on PrEP, which is preventing one who is HIV negative not to contract HIV, and those who test HIV positive are initiated on treatment. And also make sure that when young people go to our health establishments, are not going to be discriminated and stigmatized based on their HIV status, because that will make them to disengage from care, and as a result of that, they will not be adhering to their treatment, and chances of them infecting others might be very high.
Yeah, absolutely. Thank you so much for weighing in on this discussion. Anele Yawa, of the General Secretary of the Treatment Action Campaign. In fact, this is a discussion that we will continue in the second hour with Deputy Health Minister Dr. Joe Phaahla.